In this video, we will discuss about this role of platelets in the breast cancer cell homing. So in the previous video, we have understood how this cell homing plays a role, or this cell homing can be reversed in the switch diet conditions. So now in this video, they wanted to check whether it can reverse the breast cancer cells homing or not. So in the normal diet, they cannot see too much cell homings, and when they use the high fat diet conditions mice with the tumor injections, they can see the cell homing significantly in both the cases. And but however, when they switch the diet to the normal diet of the mice, they can see some reverse effect of this cell homing, and these things they have quantified in the panel B, where we can clearly see that average radiant efficiencies per mice is lower in the normal diet mice conditions, high in the high fat diet mice conditions, and when the high fat diet mice conditions diet is switched to normal diet, they can see further reductions in the average radiant signals, which is the indications of cell homings in this immunofluorescence image. Next, they also wanted to check this vascular integrity or endothelial effect of endothelials on this switch diet of the breast cancer cells. So compared to the normal diet cells, in the high fat diet cells, they are able to see more cell homings, more vascular integrities that can be seen here in the high fat diet conditions. But when they switch to this normal diet, again they see some reductions in this vascular integrity, but those reductions are not statistically significant, and these things they have quantified in the panel D, where we can see that in the compared to normal diet mice conditions, in the HFD conditions, there is a sharp increase in the average radius efficiency, which is statistically significant. But when they switch convert back to the normal diet, that is in the switch diet conditions, there is slight reductions in the gradient of vascular integrity, but that decrease is not statistically significant. Now they wanted to check, so after checking this cell homing and vascular integrity, they find out that cell homing has a more important role, which is in which the activated platelets plays a role towards these cell homings, whereas in the vascular integrity, where the endothelial cells plays a role, does not have a significant impact. Next, they check the metastasis, whether the switch diet has any role in the metastasis or not. And what they are able to find out, in the switch diet conditions, the metastasis goes down significantly compared to the high fat diet conditions. These things they have quantified in the panel F, where we can see that metastasis goes down in the case where the switch diet conditions is used significantly compared to the case where high fat diet is used, that is p value is less than 0.05. This indicates that the metastasis also goes down in the switch, is also important roles in the high fat diet conditions. So now they wanted to target the receptors that triggers this metastasis, that inhibit that receptors using the antibodies, or neutralize that receptors 48 hours before the injection of the tumor cells. And what they are able to find out is that with this, and though those antibodies, they call them as this R300 antibodies. So and this IgG is the control. In the case of control, we can see that in the high fat diet conditions, there is a more cell homings can be seen. But when they use these antibodies to neutralize the receptors on the endothelial cells, so that platelet activations goes down. So this antibodies is basically to reduce the platelet activations, and when they reduce the platelet activation, they can see that cell homings reduces significantly compared to the case of the HFD in the control antibodies. And these things they have quantified on the right hand side in the panel H, where we can see that average radiant in the control diet mice conditions is lower, and the signals in the controlled randomized conditions with this R300 antibody studies to reduce the activated platelets is further lower, but those difference is not statistically significant. But compared to the case where HFD control mice conditions, we can see that radiance intensity is higher, and compared to the case where we used R300 to inhibit platelet activations, we can see a decrease in the cell homings, indicating that this platelets plays an important role or critical role towards these breast cancer cells homings. Next, they check the metastasis, whether this platelets activations also plays a role towards metastasis or not. And in the high fat diet condition, in the control case, they see an increase in the metastasis, but when they use these R300 antibodies, they see reductions in the metastasis compared to the similar high fat diet conditions. And these things also they have quantified in the panel J, where we can see that in the controlled diet conditions there is not much difference when they use control antibodies or R300 antibodies, but when they for the HFD diet conditions, when they use the control antibodies, there is a high signals for the metastasis compared to the case where they use R300 antibodies to deactivate or reduce these platelet activations, where they see a decrease in the radiant efficiency, indicating that a reductions in the metastasis when the platelet activations, when there is a low amount of activated platelets or platelet activations goes down. So this results on altogether indicates that it's the platelet activations that plays a critical role towards breast cell homing and metastasis, and vascular integrity has a low contributions or less contributions towards the cell homings and metastasis. That's all for this video. If you need to understand more about these experiments in detail, you can go through the reference that has been provided in the description. Thank you for your time.